Our coronavirus coverage and the pandemic coverage with a look back at this past year, we remember some of our first local cases. Josephine County announced their first case on March 20th of 2020. Now, since then, the county has announced more than 2,400 cases and 57 people have lost their lives because of COVID-19. We caught up with Mike Weber with Josephine County Public Health to talk about what made the coronavirus a public health emergency and the challenges that this type of emergency present.
What makes this a public health emergency, or what makes anything a public health emergency? And there's two primary things. The first one is something that significantly impacts the capacity of the private healthcare industry. Anything that can overwhelm the healthcare industry is a public health concern. And that was a much bigger concern early on for us because of a lack of resources to utilize, whether it be PPE or even things like sterile tubing, right? Those things, private health industries need those things. And then as we moved forward, eventually got to the point of the capacity itself simply being overwhelmed due to high patient load. So that piece of it, we will see that trend down over time. But the other thing that truly makes a public health concern is an inability of the citizenry to make decisions that can keep themselves safe. The example I gave was Flint, Michigan's water resources. The citizens didn't have a mechanism to keep themselves safe in that emergency. And until you give that control and that capacity to the individual citizen, that public health emergency really stays. And that's what the vaccine means for us. The vaccine being available, becoming more and more widely available as we move forward, means that people are able to decide for themselves what actions they take, and they have a viable mechanism to keep themselves safe.
This week marks 1 year since COVID-19 was declared a pandemic by the World Health Organization and by the United States. Jackson County Medical Director Dr. Jim Shames joins us now to look back at the pandemic, how it's affected the county. Thanks very much for being here.
I'm glad to be here.
So with the benefit of hindsight, how has the county performed, you feel, in responding to the pandemic?
I think we've done well. Certainly, people have stepped up, worked really hard hours, stretched themselves. We always could have more personnel, but so I feel really proud of what we've done at Jackson County Public Health. And when I look out and I talk to our cohorts around the state, everybody's working hard. Everybody's really dedicated to doing whatever they can for the public. That's not to say we haven't made mistakes. There have been missteps, of course. We've made some assumptions that turned out not to be true. But in general, I think it's been a good time in terms of esprit de corps, morale for public health, because we know that we're all working towards a really important goal.
Logistically, would you have done anything different knowing now what you might not have known 6, 8, 10 months ago?
I think so, but the situation has changed so much. The kinds of guidance that we had early on while the pandemic was still increasing, there was a really important reliance on contact tracing and case investigation, isolation, quarantine. Those things probably are not the most important strategy now. Now the strategy would be, let's get vaccine into arms as quickly as possible to, I guess what I'm trying to say is it's a little hard to put yourself back 3 months, 6 months, 9 months, because what we know now and the situation now requires a different kind of focus. I don't think there's anything in particular. I think we could have used a lot more staff and a lot more material. I mean, if we had lots of testing, we would have done things differently. If we had 3 times the number of case investigators and contact tracers, we could have really reached out, given people what they needed, information-wise, resources to stay at home. Could have, maybe reached out and given people public messaging that might have been more effective. So I think we did well with what we had.
You mentioned messaging. Have you ever run up against some of the negativity you have surrounding COVID in any of the other public health campaigns you may have undertaken?
Well, sure. I think childhood immunizations would be an example of a fairly large, outspoken group of people who are afraid of vaccines for their children. They have a very different scientific take on the benefit, the value of vaccinations, and that's a kind of an uphill battle. And that would be one of an example. So yes, this is kind of what we find ourselves facing in public health. It's just a little different now. It's on a much broader scale, and it's part of a whole phenomenon of distrust that is a little unusual.
For those who do trust the vaccine and want to get the vaccine, how soon do you think it will be before everyone in Jackson County who wants to get that shot will be able to get that shot?
We're expecting a large increase in vaccine coming into the county at the end of this month. And the administration clearly is working hard. The national efforts of the CDC are working very hard to increase the amount of vaccine. I don't know when that's going to come to us. I'm guessing early April maybe. And that'd be about the right timing as well, because we're going to need a lot of vaccine for all the people who will be eligible at that point.
Jackson County Medical Director, Dr. Jim Shames, as always, we appreciate your time and expertise. Thank you very much.
You bet.
In Siskiyou County, public health officials say they've seen a range of impacts from the coronavirus pandemic. We spoke with Dr. Aaron Stutz, Siskiyou County Medical Director, who says it's not only been a trying year for the communities within Siskiyou County, but also for public health officials, saying that medical professionals have received a lot of frustration from the community at times when restrictions were implemented for safety.
We've faced criticism from the community at large over our decisions and our decision-making process. We have been working extra hours from time to time and having to decide where to put our efforts. We only have a small staff compared to some other counties, as we're a small county. So we don't have the resources available to us that many larger counties do. So that's put extra strain on our staff for sure.
Now, doctor says that the level of stress on people is unprecedented, especially for public health professionals. The stress in combination with consistent criticism has taken a toll on many medical professionals' mental health. That's according to Dr. Stutz. He also says he never expected all the decisions surrounding COVID to be right. It is an unprecedented situation that's constantly evolving. He asked that the community members try to remain patient as health professionals do their best to keep everyone safe and healthy. Klamath County will be moving down to the moderate risk level tomorrow, and as the county prepares for this next step, health officials will take a look back on the pandemic and the science that helped them get to this point. The county's first positive coronavirus case was detected on March 7th. Valerie Lane with Klamath County Public Health says the county was fortunate enough to not see a COVID-19 death until early July. But a month before that, Valerie Lane says they already knew of work being done for possible vaccines. She says in June, it seemed like vaccines weren't going to be viable for another 18 months, while others were predicting Christmas time. She says, thanks to the science that was used, this prediction was able to become a reality.
And I think that really, it's pretty amazing to think about that we live in a time that work was already being done towards the SARS virus. They were able to piggyback on that. And now, a year later, we're seeing vaccine hit our most vulnerable population.
Valerie Lane says every member of the community is valuable, and to see the 54 deaths in Klamath County is incredibly challenging for her to think about.